Welcome, and thank you for standing by. At this time, all participants are in a listen-only mode. During the presentation, we will conduct a question-and-answer session. To ask a question, please press the *1 and please record your name. Today's conference is being recorded. If you have any objections, you may disconnect at this time. I would like to introduce your host for today's conference, Rose Armour. You may begin. Armour?
Welcome to the How to Create a Culture of Evidence in Your Community or Organization webinar. As the operator mentioned, your phones have been muted on entry, and we will have time throughout the call to have brief Q&A after each presentation, and then we'll have a longer Q&A at the end of the call. You can submit questions via the chat or Q&A on the right-hand side of your screen. Please make sure to submit those questions to all participants just to make sure that we are able to see them. And thank you, and I'd like to hand the call to Dave Wilkinson, the Director of the White House Office of Social Innovation. Dave.
Thank you, Rose. So glad to be joining everyone here on this call. This is the third session in the MBK What Works Technical Assistance Series, How to Create a Culture of Evidence in Your Community or Organization. And we have a great lineup of speakers here for you this afternoon. I'm Dave Wilkinson. I'm the Director of the Office of Social Innovation here at the White House. And we are very happy to be working closely with the My Brother's Keeper team at the White House and beyond to bring you this What Works TA series. Before we jump in, I want to briefly talk about how this What Works TA series fits into the overall picture of MBK. And so, as many, if not all of you know, MBK has at its core and in its DNA a dedication to identifying, building on, and scaling the solutions that work for boys and young men of color across all the MBK milestones. Programs and interventions that have shown measurable success are a priority for us. We know that there are interventions across the milestone areas that have been rigorously evaluated and are showing far better results than business as usual. And we owe it to the clients and the recipients of services to give them the best that we can offer. We also know that there are techniques and approaches to creating a culture of evidence, whether it's a focus on better accessing and using data to understand whether our interventions are working and getting the outcomes we hope, whether we're using data and analytics to learn, course correct, and continually improve. And having a culture of evidence, we think, is particularly important in building a social sector and in building MBK-focused initiatives that are ready to use the best solutions that are evidence-backed, that are ready to deploy in lightweight, low-cost ways wherever possible, evaluation and data analytics to identify what is working and perhaps what is not working, all in the effort to better serve the communities in which you work. So without further ado, I'm going to pass it off to Laura, Senior Policy Advisor on my team, who will be serving as the moderator for today's call and today's great speakers. Thanks.
Thank you, Dave, and thanks to all of you for joining us today. Next slide, please. As you can see on our agenda, we're going to hear from a series of wonderful speakers on the topic of creating a culture of evidence in your community. We're so grateful for everyone's time and the knowledge our speakers and participants will be sharing on today's webinar. To start us off, I am pleased to introduce Guylaine Saint-Just, who is Executive Director of the National Capital Region at YourPowerNetwork. Next slide, please. He joined YourUp as an executive director this past September and believes that a culture of intention and high performance is instrumental to growth and scale. YourUp's National Capital Region is a fast-growing organization seeking to close the opportunity divide by serving 320 students per year and connecting young adults to the companies looking for resilient, committed, diverse talent needed to achieve their business objectives. Now, Guy, can you start by telling us how YourUp defines data and then how you think it's best to equip a team to see the value of data and to build the team members' capacity to use data?
Absolutely. Welcome, everyone, and thank you for making time for this, and thank you for the introduction. So we believe that we have 4 components for creating a culture of outcomes at the YourUp National Capital Region. And I will just go through the 4 really quickly, and then I will go back, if that's okay, and share some anecdotal to support that. So number 1 is, it's not only choosing to get the data, it always starts with a choice, choosing to get the data, and then choosing what data to collect. The number 2 is demonstrating values to your stakeholders, whether it be internal or external, and external stakeholders could be twofold. It could be a board, it could be funders, it could also be the constituencies that we each serve, because they all play a role in it, is to demonstrate the values and helping people understand why data and why should everyone pay attention to the data being collected. Number 3 is to engage in disposable and digestible ways to present the data, because I don't think many people would like to see like a lot of pie chart. At least me, they give me, they make my eyes cross. But to really choose ways that are engaging and digestible to present the data and to do that. And then to choose to use the data to guide decisions, so that everyone sees how the collection of the data guides the decision-making process within the organization. I think we're on the next slide. So I will talk a little bit about each one of those, and I will try to tie them for you with the slides that you're looking at in terms of YourUp's Salesforce being YourUp's primary platform to gather data since 2007. And you can read the slides first off, so I won't bore you with the slides. So let's just, if I may, talk a little bit about what each one of those bullets I just shared with you, what that means. So getting the data and choosing what data to collect. So I'll share with you all that we've got such a culture there that my Director of Research, Garrett Warfield, was interviewed recently by the Chronicle of Philanthropy, because in a way we have to be very careful that we must be collecting too much data. So just be careful, that's where we come from with collecting the data. So for us, it's around the theory of change, and to support our mission, we have decided that we are focusing on 6 key data facts. First, we want to be sustainable and build capacity for our growth and our scale. So financial management is critical to what we do. So staying close to making sure that there is a strong sense of that, and that each executive director has P&L experience. The second part for us is the admission process. So being very clear about who we serve and tracking pipeline through the admission process. Then you have the retention, right? What are we doing in that spirit of high support, high expectations, but how is that working, and how are we retaining our young adults during the L&D phase? Then we talk about internship. Are we sure that every young adult is matched to an internship that is meaningful to them and that's allowing them to practice the skills that they've gathered during the learning and development phase? Our outcome. So we are very, very proud of our outcome that says that 85% of the young adults that graduate the YourUp program go on to secure jobs at livable wages. And for us right now at the National Capital Region, without even looking at any report, because of that culture of outcome and data, I know that my average young adult that just graduated are making on average $18.60, which is close to $3 million of economic values that we've added into the economy. And so the way that we've done this is we've called it FM radio, right, for retention, admission, our development, our internship, and our outcomes. So clearly not in that particular order, but when we talk about presenting the data in a way that is engaging and disposable, that's how we came up with the FM radio. In terms of demonstrating the value of the data, you could choose to collect the data as much as you want to until you answer the why, and that there's that discipline within all members of the team and all your stakeholders to actually collect the data, right? Answering that question and instilling a discipline that data must be collected. And so at any given point, I can go into Salesforce and I know where we are with our development activities, not only in what's been collected, but the pipeline out 90 days or even what we're focusing on for this year, and so along every single one of our metrics. I don't want to bore you again with engaging in disposable ways, but if we go to the next slide, you'll be able to see how we do dashboards, how we, next slide again, please. You know, how we do dashboards, you know, so that, you know, they're fun, they're easy to read. This is a sample, so that they're easy to read and so that it gets people excited around a culture of performance and a culture of outcome. And then the slide before, I think I'm going to drive the presenter crazy, is you know, how we use surveys and survey results in action. And so what that helps us decide is, are we really training for jobs that matter in this marketplace? And we collect data in terms of the satisfaction of our partners who employ our young adults. And we track that data in the form of survey, right? And so as a practitioner, what that allows, you know, for example, me to do as the leader is when I look at and I say, wow, you know, 50% of our partners are often, so 25% of our partners are always happy with our technical skills. So I can take that data and say, okay, what do we need to do to convert that 50% that's often to always, and how do we move the 21% to often so that we create incremental growth? And so it allows for great conversation with my director of academics to understand around a set of data what are the behaviors and activities and attitude, if you would, that are driving those surveys, and where do we make improvement to the curriculum that we're delivering, so that we can make sure that the skills that we're teaching in the classroom match what the employers are looking for. I think I probably am over the 7 minutes that was allocated, so you can go through the other slides or make that available to you. But, you know, this is, again, another example of some of our metrics and dashboard that, you know, we can look at. But I don't want to exceed our time. I want to be incredibly respectful of everybody's time. And so I know that there were some questions, you know, so there was a little bit of time so for a couple of questions, so I'm open to that. And while we're doing this, I would just open it up to share just quickly some of the studies that we have done with PACE, with other organizations that we get to come into our program and evaluate, just to consistently know that what we're tracking for and what we're doing is truly what's happening, sort of like, if you would, looking at those organization as a credibility factor, and B, as an audit, if you would, to keep us honest that what we say we're doing is actually what we're doing. So with that, I'll open it up. There's a soon to be published, and you know, these are some of the other studies that we've done, but again, want to be incredibly respectful of the time that's allocated for this, and wanted to see if there were any questions
all right,
with what we've shared so far.
All right, if there is a question on the phone, please press the *1 and please record your name. Again, press *1 to ask a question. One moment. There are no questions at this time.
Perfect. Thank you again, everybody. Back to you.
This is Laura. Just one question we had over here. Thank you for your presentation, and also just want to note to all the participants that these slides will be available along with the recording of this webinar. Key, I'm wondering if you could just share a piece of advice for an organization that's interested in data collection and analysis, but maybe doesn't have the resources to do so. Are there any simple steps an organization could take to check and measure progress?
Absolutely. I don't think it needs to be very complicated. I mean, clearly at YourUp we use Salesforce, but Google Docs has a very, very accessible, I would say, method of tracking. And so I think really technology certainly makes it easier to digest the report in terms of dashboard and so on, but even if it's an Excel, as simple as an Excel spreadsheet, and just the discipline. I think the key question there, Laura, is the discipline of gathering the data and answering the question why, and helping people align and understand that it really serves as a model, to justify, if you would, the existence of the mission and the existence of the model. But I think simple Excel spreadsheet so that you know the names of people that are being contacted, a simple database collection website, just anything where you can store the data so that it's available. Did I answer your question?
Yes, that's very helpful. Thank you so much.
And we do have a question on the phone. It's from Angela.
Hi,
Angela.
I'm here. I think I'm here.
Yes, you are. We can hear you.
Okay, thank you. So what does your team look like to really be organized well, to do the work and to sustain the work? Is it a combination of higher ed? I mean, I'm just trying to get a sense of what kind of capacity a community really needs to have to be able to do this well.
So again, I don't think it's I will use an I statement there, if you would allow me to, Angela. I don't think it's about the capacity in terms of the number of staff, because I'm sure that the number of staff is reflective of the budget, of the annual budget, and the mission that you serve. I do think it's, again, a matter of discipline, of choosing to say, okay, we are going to be a culture of outcome. Here is why. And even if it's a 2 or 3 person organization, but to say, what are the methods by which, what is it exactly that we want to track, right? That was bullet 1, is assessing what is the data that you want to track, right? And then deciding on, based on your budget, based on where you are, what is the system or the mechanism by which you're going to collect the data. And then, quite frankly, is to just being relentless about collecting that data. And it would go through all the multiple phases of anything that you want to, as a leader that you are endorsing as an organization. It starts with the sharing with the team, answering the why, instilling the discipline, helping people get there, helping them use the systems that you're using, enforcing it, making sure that it is implemented, and then before it actually gets embedded, and then once it's embedded, it becomes part of the culture.
Wonderful.
Thank you.
Thank you for that answer, and Angela, thank you so much for that question. We are going to move on to our next speaker now, and I'm pleased to introduce Johanna Vespi, who is Director of CEO National at the Center for Employment Opportunities, which is an organization that offers comprehensive employment services exclusively for people with criminal records. Johanna oversees program performance and contract management for all of CEO's national offices. Her key responsibilities include developing and managing a scalable system for performance management across national offices, ensuring fidelity with the CEO model, and providing support on fiscal matters. She plays an integral role in the expansion efforts of the organization, which include the launch of new offices, training new or existing staff, and creating an environment to cultivate and grow high-performing staff. Johanna is going to talk a bit about how to create a culture of data-driven decision-making that can support both ongoing check-ins and also longer-term evaluations to test whether the theory of change is working. Johanna, can you tell us what CEO is doing on this front and how your experiences might inform others?
Sure. Hi, everybody. Good afternoon. Thank you for the introduction. It's a pleasure to share CEO's experience and examples of how we've come to adopt and embrace a culture of using data and evidence to strengthen our program delivery and participant outcomes. At CEO, again to reiterate, we do one thing for one group of people. We provide immediate and comprehensive employment services to men and women recently released from incarceration. We started in New York City, and we've been providing services to this population for more than 3 decades. Over the last 6 years, we've expanded our reach into 3 other states, and we are now serving close to 5,000 people per year. We are now at the beginning of a new stage of expansion with the goal to double in size so that we can make a more significant contribution to ending mass incarceration while increasing public safety. So you can see on this slide, with our mission and goals clearly defined, we rely on our theory of change to translate our strategy into the actions we take every day to achieve results. An organization's theory of change is essentially a blueprint for success. It connects your mission with your goals and daily operations. It also serves as a framework for implementing case management at the staff level. CEO has a 4-step model. It begins with life skills class, where participants are assisted with documentation, resume prep, and interviewing, especially around addressing the conviction question. At graduation, participants become employees of CEO and begin working on one of our transitional work crews. At the end of the day, participants are evaluated on their work behaviors and receive a paycheck. As they are working on these job sites, participants are also receiving coaching and job development to leverage their current work experience to secure full-time private sector employment. Once placed in a job outside of CEO, all participants receive a year of retention services that help them stay connected to employment. As you can see from this slide, CEO's theory of change holds itself accountable for short-term and long-term outcomes. These outcomes are necessary for our participants to enter and remain engaged with the formal workforce. Moving on to the next slide. An interesting fact about CEO is that we were established as a demonstration project by the Vera Institute of Justice. This to test if transitional work programs could reduce recidivism. Because of the positive effects the program had on recidivism, CEO spun off and became a nonprofit in the 90s. This premise to test and evaluate has remained a guiding force and is truly a part of our organizational DNA. Looking at the trajectory of CEO on this slide, our journey is characterized by using data and generating evidence to innovate, expand, and manage performance. Here you can see that our theory of change was developed prior to the final results from the randomized control trial, which I'll also get into in the next slide. Rather than wait for the full results of the evaluation to be released, CEO moved forward with program improvement and reacted early to early findings by strengthening service delivery. Another highlight I'd like to point out here is the time between implementation and full adoption of Salesforce.com as our performance measurement database. The transition to new technology and data collection not only presented technical and training issues, it also represented a true cultural shift. With Salesforce, the organization made a clear decision that documentation and data collection was key to supporting our narrative of success with evidence. This was not easy on management or staff, and in some cases, staff self-selected to leave. Central to CEO's pursuit of evidence was the role of the evaluation on the next slide. A randomized control trial is the most rigorous form of evaluation because it eliminates selection bias by randomly assigning individuals into a treatment group or a control group. Only the program group receives services being studied. As you can see, based on the outcomes of the RCT, we demonstrated significant impacts on recidivism, even after 3 years. CEO was shown to significantly reduce the likelihood of rearrest, reconviction, and reincarceration, in addition to enhancing public safety and creating taxpayer savings. Results showed up to 20% of reduction in recidivism, generating taxpayer savings for every dollar spent on the program. Committing to the RCT was not an easy decision to make, but it was important for us to know if we were actually making a net difference.
These findings define what an RCT is for folks on the phone who might not be familiar with it?
Sure. An RCT is a randomized controlled trial evaluation in which one group coming into the program is randomly assigned to participate in the full scope of your services. So in the case of CEO, participants who were referred to the office were either, treated as a control group in which they received, just library, job skills, computer search-based techniques, but the other group that was also tracked received services ranging from coaching, development, to actually working on the transitional work crews. So the two groups were compared against each other, and those were the results that at the end of the trial period resulted in CEO having an impact. Is that clear?
Yes, that's great. And if you could just take another minute or so to wrap up your presentation, then we will move on to questions.
Sure. So moving on to the next slide, when you're managing to outcomes framework, you're going to want to ask yourself, do we have measurement and management framework in place? And by performance measurement, we mean what do we have to measure and not measure to provide collectible and reliable data? And by management, I mean, will we learn and respond to data to ensure the desired outcomes achieved? To foster this culture of using data and evidence, your program's going to have to be well-designed with clear deliverables, have disciplined management and invested staff, and a process for quality assurance and evaluation. Moving on to the next slide is an example of how we at CEO monitor performance and monitor participant outcomes. So on this dashboard, what you're looking at is a manager monitoring key indicators ranging from employment calls to interview referrals to actual placements. Rather than just focusing on the outcome, these dashboards help frontline staff understand their performance against the underlying drivers of goals and outcomes so they can adjust efforts as needed. So you might ask yourself, again, why do we move on to this culture? Why do we invest all of our resources? And if you can learn anything from this presentation, it would be to walk away with 3 key takeaways. You can move to the next slide. First, it's important to develop a clear and realistic expectation and measurable theory of change. Second, collect, summarize, and visualize data in a way the frontline staff can better manage to performance outcomes and program improvements. And lastly, engage in evaluation, but only after you've mastered the first 2. Even though performance management seems distant from the participants we serve, it is the tight focus on this aspect of program performance that ultimately leads to the improved impact and outcomes for those we serve. Thank you.
Thank you, Johanna. While we're waiting to see if any questions come in, I'll pose one to you. Very helpful presentation, and appreciate you talking about 2 different ways that an organization can measure progress, both ongoing monitoring of performance as well as undertaking a programmatic evaluation, in your case an RCT. Could you just tell us a little bit about the staff capacity that's needed for each of those efforts, both the ongoing monitoring of performance through Salesforce and then also the staff capacity needed for the RCT, and whether those are the same type of capacity or different?
Sure. So I would say that, the staff capacity is certainly different. For the RCT, for the randomized controlled trial evaluation, you're going to want to ensure that you have program staff that are, measuring from the top down sort of what your theory of change is promising. And in our case, it's myself over the national offices along with a program associate. We also have a learning and evaluation department, which, aggregates all of the data and analyzes it to then inform the decisions we're making at the programmatic level.
Great, thank you. Rose, do we have any questions coming in from the audience?
Kathy, has anyone posed any questions?
There are no questions at this time.
All right, fantastic. Well, Johanna, thank you so much for that presentation. We are now going to move on to Karen Lyons, who is a manager for tool development at the Pew MacArthur Results First Initiative. Karen oversees resources that make evidence accessible and useful to policymakers. She's going to talk to us about how one organization's data and evidence can contribute to the broader conversation and findings in the field. Karen, can you start off by telling us what a clearinghouse is and then give us an example of how local governments are using these clearinghouse databases?
Sure, I'll get to that in like 2 slides. I'm going to start first by, thank you for the introduction. I'm going to give you a little bit of information first about the Pew MacArthur Results First Initiative, or Results First. We work with state and local governments to help them incorporate evidence into their policy and budget decisions. We're now working with 22 states and 5 counties. This is our approach. I'm not going to go through all of it, but I am going to talk a little bit about the first one. One of the first things that we ask our jurisdictions to do is to compile a list of all the programs they're currently funding in a specific policy area. We ask them to collect a bunch of information, but one of the key things and what's really relevant for today's discussion is there evidence for your program? And we say, look and see if your state has done an evaluation, if your county, if your locality has done an evaluation of the program. And of course, in most instances, the response is no. As we know, a lot of times jurisdictions lack the resources and capacity to do these evaluations. And so we try to think of ways that we could tap into the research base that exists, because there is a big research base out there. And so our solution was to come up with the Results First Clearinghouse database. Next slide, please. So first, what are clearinghouses, as Laura asked? So clearinghouses are organizations. They can be part of the federal government or nonprofits, and they provide information on the effectiveness of interventions. The way they do this is they go through and they find and review rigorous evaluations, such as RCTs, of different interventions. Then when they go through, they generally kind of score evaluations on different aspects, and at the end of this, they come up with a rating for the program. The rating generally is a combination of the effectiveness of the program, the quantity of evaluations, as well as the quality of evaluation, and that's really important. As we were just talking about, the RCTs are the highest kind of quality we have out there, and so it gives you more confidence that the effectiveness that you see is really related to the program or as a result of the program. The ratings that they assign are generally pretty easy to understand, things like model, effective, positive. But one of the other great things about the clearinghouses is they're just a wealth of knowledge. For each intervention, they also include information, a description of the program, target populations, the outcomes that have been reviewed, settings. And for our jurisdictions, and I think for other people using this for matching purposes, this is really important, because if a jurisdiction is trying to see, is a similar program or my program, has it been reviewed by somebody else, you need to know that context, because they could say, I'm doing this program and it's 6 weeks long and we meet twice a week, and then there's a program that looks similar. A lot of the names on here are very similar, but maybe it's 20 weeks long and it meets twice a day. That's not going to be the same program. So having that additional information is key. And also when you're looking for a program to implement, if you're trying to think of what would be a good program for the people that I serve, obviously target population is key. If we're looking at 15 to 19-year-olds versus 40 to 45-year-olds, Setting becomes very important if you're looking at community or school, or if you have some kind of facility. That all makes a big difference. Next slide, please. So what we did is create something we call the Results First Clearinghouse database, and basically we took all of the rated programs from 8 different clearinghouses and put them all together in one place. This is publicly available, and I think this will be sent out after the webinar. And what I'm showing here are screenshots from it. As you can see, the clearinghouses we include are across different policy areas. Usually clearinghouses focus on one or more policy areas. And the reason we did this, and I think people that work with MBK know very well that populations bleed across lines. If you think, child welfare populations can become juvenile justice populations, can become adult criminal justice populations. Mental health and substance abuse issues definitely play into a lot of that. Education is key for avoiding some outcomes. So that's why we wanted to put these all in one place. Next slide. The one issue with the clearinghouses is I kind of said they each have their own different methodologies, but they also have their own terminology. And when you're looking just at one clearinghouse, that's not a big deal. However, when you're looking across multiple clearinghouses, we realize it's really difficult for people to say, wait, what did model mean? This one calls it positive, or this one calls it beneficial. Are those the same? And so we created a really basic and simple color coding system. And basically we said, if you're the highest, the rating is the highest rated, you're going to be green. That's not to say that the blueprints, model, and what works positive are exactly the same, because their methodologies are different, but they're very similar. I think for most people, they're very, very similar. So what this allows you to do is when you look and you see a program and you say, oh, it's green, you don't have to worry about the rating. You can say, oh, I know that's kind of the top program for this clearinghouse. Or if a program's been reviewed by multiple clearinghouses, you can look across and see, oh, everyone gave it a green, or some people gave a yellow. And we can talk about why that might be, clearinghouses might rate programs differently, but again, it allows you to compare programs across clearinghouses. Next slide, please. And the one thing else I would add is right now we have about 1,000 unique programs in our clearinghouse base, and that will be updated very soon. So here's where you search for programs, and I think of interest to the people on this call, one of the policy areas we have is education, and then intervention types we have early childhood, K-12 dropout prevention, K-12 literacy, post-secondary education, and then another policy area we have that I thought might be of interest was youth development. And these are programs that we actually coded ourselves because we kind of saw that there were these categories that seemed similar across different clearinghouses, and they didn't really fit in necessarily a policy area like crime or child welfare. And so within youth development, we have interventions types such as character education, classroom environment, prevention of risky behavior, social competence, and violence bullying prevention. And so when you do your search, which is what's shown here, the programs that have been rated that according to your search will appear, and then the dots will appear in the clearinghouse that's actually rated the program. If you are to scroll over, you get what this slide is showing. And the key here is when you click on that Learn More, it takes you back to the clearinghouse page. As I kind of said, we're really big fans of the clearinghouses, and the idea here is not to drive traffic to our website. You see there's no like ads or anything. We're not making money off of this, but really what we're trying to do is create a portal to make it easier for people to access information from the clearinghouses. And so if it works better for people to go directly to the What Works Clearinghouse or crimesolutions.gov, we totally support that. Again, we're just trying to make it easier for people to get to those clearinghouses. Next slide. And so how have people used this? Again, the first one is kind of what I talked about at the beginning. Our jurisdictions have used this to determine if there's evidence for programs they're currently funding. One of our states did this for child welfare. They found that a lot of their programs had no evidence, and those that did were not effective on child welfare outcomes. And so they're now starting discussions with their child welfare agency to think about how do we start thinking about evaluations, improving our programs, or piloting new programs. Another one of our states found there wasn't a lot of evidence for their criminal justice programs, so they're now working with their university to at least start looking at the recidivism rates of people that have gone through these programs, again, as a first step to the evaluation. And then the other big thing is using this to identify effective evidence-based programs for future use. If you have additional funding, or if you're thinking about fading out a program or piloting a new one of our states, their female offender population was skyrocketing, or their recidivism rates for them were skyrocketing. So they moved them out of a private facility to a state-run facility where they can control programming, and then they're using the clearinghouses to find good programming for these people. Again, this is a population where you really want to target them because generally female offenders have different needs than male offenders. And then some of our counties are building some new jails and rehabilitation facilities, and again, they're using the clearinghouses to figure out what's the best kind of program we should be offering to the offenders in those. So I think that's it on mine. So that's it. So thank you. Please let me know if you have any questions.
Wonderful, Karen. Thank you so much. That was a really helpful overview of how knowledge of what works can be disseminated, and I think that nicely complemented our first two presentations that really focused on how service-providing organizations are figuring out what works. Karen was talking about how once an organization knows what works, how that information can help inform the work of others. Are we getting any questions in? We've got one here that we can share if we don't have one on the line.
There's no questions on the phone, but if you do have one, it's *1.
Great. And Karen, the question we have here, clearinghouses obviously are treasure troves of information. They have so much knowledge. They can also be a little daunting to look at and explore. And what advice would you have for people who are looking at a clearinghouse for the first time? What do you think is the best way to tackle the beast that can be a clearinghouse?
I think it's key to look at, kind of dive into one program, and generally you can, most clearinghouses have a list of all the programs that are in it, and just click on one and to get familiar with the layout of the page, because that's going to be replicated for every intervention. So to see what's on the right-hand side, usually they have a summary of the key statistics, somewhere, either the right-hand side or maybe the top. What are the different kind of sections of that page? What are the things that start focusing in on the things that you find important? Maybe you don't care as much about the citations, but you really care about the components, or you want to look at what are the evaluation findings. And so really kind of familiarize yourself with one kind of intervention, and then as you move to other ones, it's repeating. And I would say, I think that people, I know generally are daunted by the clearinghouses, but there's just so much information, and I think, again, once you spend a little bit of time on there, you'll realize that it's not nearly as daunting as it appears to be.
Excuse me, we do have a couple of questions on the phone. The first one is from Yusef Mays.
Hello. Hello.
Hello.
Hello. How you doing?
Good.
Good. Okay, I'm here. Okay. Yeah, I had a question about now, is there a cost to the programs to be a part of a clearinghouse? And also, once you're a part of a clearinghouse, does it give you access to funding?
So there's no cost to be part of a clearinghouse. The way it generally works is you have to have a rigorous evaluation has to have been done of the program, and then either it's published in some kind of journal or at least available publicly in some sort of way, and so the clearinghouses can find it. But they're very objective. Again, they're just looking at the research base and trying to find evaluations. And then once you're on it, you don't qualify for funding, but more and more, particularly in the federal sphere, people are requiring or giving extra points for programs that appear on clearinghouse lists or that can prove that they've have been shown to be effective by reverse evaluations, and kind of, again, clearinghouses sometimes are a way that they can show that.
Okay, thank you.
Thank you. And we do have a question from Karen Jettinger.
Yes, I'm wanting to back up just a little bit and find out how we actually find the clearinghouses. If you talked about that recently, I may have missed it because of the trying to record my question.
Yeah.
But I'm not sure where to even look.
So again, after this webinar, they're going to send out a link at least to our results first clearinghouse database. And if you were to go to that, we also have a user guide online, and in that it actually has the links to all of the clearinghouses that are in our site, so they'll take you right there. Or you can, again, once you look at our site with all the names, you can Google them. And ours are pretty comprehensive. We kind of include the biggest ones. There's a lot of smaller ones out there that are more specific, but these are some big ones that, again, we feel comfortable not promoting, but making sure people have access to them.
Okay, and you mean the Pew MacArthur site? Is that what you're referring to, right?
Yeah.
Okay.
All right, thank you. There's no further questions.
Great, thanks.
Great. Thank you, Karen. Thank you so much. This is a really helpful presentation, and as she mentioned, we'll be sending around a link to the database so you all can explore afterwards. I'm now pleased to introduce our last but not least speaker, Linda Gibbs. Linda is a principal at Bloomberg Associates. Previously, she served as New York City Deputy Mayor of Health and Human Services from 2005 to 2013. In that capacity, she supervised the city's human service, public health, and social justice agencies. She spearheaded major initiatives on poverty alleviation, juvenile justice reform, and obesity reduction. One of these initiatives included the Young Men's Initiative, which many of you know addresses race-based disparities facing Black and Latino young men, focusing on the areas of health, education, employment, training, and the justice system. Linda was also a champion for improving the use of data and technology in human services management, contract effectiveness, and evidence-based program development. Linda, you also, in your capacity right now, have had a lot of great firsthand experience working with MBK communities, and would love if you could talk about how MBK communities can integrate efforts to build a culture of evidence into their local action plans, and for those that might already have local action plans and be implementing them, how this culture of evidence can help with the implementation process.
Great, sure. Hi, good afternoon, everybody. This has been super, really, I've learned a lot on this webinar, so I appreciate participating. And maybe just to shift the frame a little bit, what we've heard so far, we had two really evidence-based programs described to you, kind of the rigor of the work that they do in order to produce evidence around the effectiveness of their intervention. And then for anybody who has searched for good evidence-based programs, you know that you just got the golden link to the Pew website, because that is going to provide you just remarkable information about the knowledge that's out there about what works. And so taking that and sort of shifting it, I put myself in the position of a city that is either doing an MBK plan now or has completed a plan. And what I know about the cities that I've worked in is that those plans include many things, sometimes dozens of initiatives. And some of them have strong histories of evidence behind them, and some of them don't. Some of them are maybe a really creative new idea. Some of them maybe are the mayor said do it, so you're doing it. And so the range of what's going on in the MBK plans and what you sort of wrapped up into your document can include everything from sometimes junk to sometimes like gold standard evidence-based programs. And so what I thought I would do is just do a little quick outline of, if I were to come into a city and help a city, what I would say to them about the best way of putting an evidence-based framework around the existing MBK work and getting the most knowledge out of what you're doing. So, so looking first at the measuring program activities, and I distinguish this from evaluation because for every single initiative that are part of the MBK plans, I think it's really important that we have clear metrics on, what's the input, what are the outputs, and whether or not there is success in achieving the goals as articulated in those programs. And this, the White House has been really clear and very supportive all along that they want the MBK work not just to be a lot of activity, they want it to produce impact for the populations that we're serving. And so the more that we can quantify what we're doing and what results we're getting, the better we're going to be at communicating our story, but also understanding whether or not we're achieving the things we say we want to achieve. So the core components on the next slide are really the steps of the process that you would want to see. And I think that we saw from the presentation that Johanna gave on the CEO that this is exactly how they went about doing their design for the CEO employment programs. So the first step, and so what would I would actually just create a little audit process. Take a list of all the MBK programs, and for each one, answer these questions. So first, what is the theory of change? And basically, the idea there is your hypothesis. You're doing something because you believe it's going to have an impact. What's the belief that you've got going on about how this activity is going to result in a better outcome? The second then is to define the outcomes. If you believe that offering mentoring is going to improve high school graduation rates, if that's what your mentoring program is structured to do, then your theory of change is by offering a mentor of this size and shape with this much time, it's going to help kids who are off track to get back on track and graduate. And so you say, okay, 500 mentors, 1,000 kids, and we're going to take graduation rates for that cohort from 50% to 70%. And so really concrete measures. Instead of 500 graduates, you're going to have 700 graduates, and you're going to gather the data to understand whether or not the mentors are showing up, whether or not the kids are getting engaged, whether the kids are enrolled, and whether or not the outcome is being achieved. And so setting those targets and then having the feedback loops. Every program will be different. Some will be super simple administrative data. Others will be a pain in the neck. You're going to have to run around after people. I know in a lot of the employment training programs for people who are discharged from jail and prison, they sometimes pay them bonuses just to reply to a survey to tell whether or not they have a job, because it can be really hard to track down individuals and get the information about the outcomes. So sometimes you have to get really creative about getting that data back. And then the last two items here are really important. Feedback loops and corrective action, particularly for new programs, you got to give them a little while to demonstrate, you know, to get their sea legs on, you know, work out the kinks in the process, make sure they work. And using the data to kind of jump in and intervene where you have programs that are doing really poorly, and be supportive and help them to problem solve and tweak the process in order to identify whether or not the intervention is not working because the idea didn't work, or whether it's not working because people just have to figure out how to, you know, make it all work effectively first. And so using the data to provide that feedback and do corrective action. And so every program, say you have 30 MBK programs, you really should be able to answer every single one of these questions and for all 30 of those programs. And so moving from that, I want to distinguish that from really evaluating effectiveness, because you can have a program that works really great, but the ultimate outcome you're trying to achieve is not achieved. And that's where sort of more sophisticated evaluation methodologies come in. And in some cases, the outcome does tell you whether or not it worked. In other cases, it's kind of an intermediate outcome, and it's not the real outcome in terms of improving social good that your intermediate outcome is intended to influence. And so evaluation can be costly, time-consuming, and staff-consuming. So just looking now at the last slide, what my advice on this would be is that you want to, let's go back to our list of 30 initiatives, that you'd want to look at that list of 30 and say, which are the ones where we think we've got something big going on here and we really want to double down on evaluation and make sure that we are getting the best information we can. And maybe the best way for me to do this is to give an example of one program that we had in New York called CUNY ASAP. It's a program to improve graduation, two-year graduation rates for community college students. When we started that program, we had lots of outcome tracking, like I said in phase 1, but we had no evaluation program. 2 years in, it was showing tremendous success, and we're like, you know, eureka, we got something going on here. So what we did is we retrofitted a comparison group out of administrative data, and we looked at a bunch of kids who looked an awful lot like our CUNY ASAP kids, and we looked at their outcomes compared to our outcomes. And it looked like it was as good as the administrative data was suggesting. And so then we moved to a random control trial, because we said we have something really special here. This one is worth investing the time and effort and doing a random control trial. And so we moved to random control only at that stage. And so cities do not have the luxury of doing fancy evaluation on everything. And so my recommendation would be, as we do this work across the country, localities that are generating really creative, innovative ideas need to put their effort into identifying which are having the most early signs of impact and connecting with partners at universities, research institutes. Some of these resources like Urban Labs and the Jamal Poverty Action Lab that will partner and provide technical assistance at no cost to get the knowledge out of our cities and out of our systems to be able to build that, expand that library so that, Karen will have to keep expanding her evidence base that she's connecting everybody to through her network. And so but I don't think people should expect that they can do a high-end evaluation strategy on every project, and so it's really about making those judgments about which ones make the most sense. And that's me.
Wonderful. Thank you, Linda. Linda, you spoke a few times about administrative data. Could you just define what administrative data is and explain how people can access it?
Yeah. Administrative data is all the stuff that all your frontline workers spend all their time complying with somebody's demand that they do data entry, and they put all kinds of information in, and they don't often get information back. And so, administrative data can be a federal database on child welfare, or a compliance database that you are submitting that gives case-level information that sometimes, but not always, will track outcomes for the people who are participating, but generally have baseline information about recipients and some demographic information. It's a treasure trove of information that cities sit on and really struggle to figure out how to use effectively. And to get it, to use it, you do need to have an investment in the technical staff that can help to format it and produce usable information that can inform how programs are working.
Wonderful. Thanks, Linda. And we had a question that came in from the chat feature. The question is, can you articulate some of the evidence-based practices that you've seen in cities or gold standard models?
Yes. So, it's really interesting. So, as several people have already said, random controlled trials are, and there's a reluctance to continue to call them the gold standard because it implies that anything less than random control is not highly valuable. But it is the most high end, let's call it, where you actually design a program and then select a group and then randomly assign the group to test and control. Below that, now it's interesting, folks like JPAL are starting to do what they call found random controls that somehow, particularly like summer youth employment, if you have any kind of a program where the number of participants is not is higher than the number that you can serve, and those who get served are randomly selected, then you've already done random control design, and you can use the data from those individuals in order to understand whether your intervention worked. And New York and Chicago have both done that kind of retrofitted random control assessment of their summer youth employment programs, but it might occur in other environments as well. But then, a simple comparison group. So back to the CUNY ASAP example I gave. We had, I think it was like, 1,200, 1,400 young people enrolled in the program. we didn't do an evaluation to begin with. And then when we wanted to get there, we also retrofitted an evaluation. We said, okay, here's what our 1,200 students look like. They're 45% men, 55% women. They're this array of race. They're this array of income. They're this array of borough. And there were so many students at CUNY that we were able to create a comparison group that was roughly the same size and shape as our CUNY ASAP students. And we looked at the administrative outcomes for those students, the comparison group that was a historical information. And so that's a cheaper way because, you know, other comparison methodologies are you can look at the trends in the same population over time. So at our social impact bond project on Rikers Island, we compared the kids on Rikers who got the treatment to the same cohort of kids over the prior 5 years, and then we compared it to the cohort of kids in Rikers at the same time as them who were just 2 years older. And so we had kind of two comparison groups there. And that works when it's best when your program is going to serve 100% of the eligible population, and you don't want to randomly assign because you can serve everybody. And it also works when you just don't have money to pay for a fancy random controlled trial. And then, you know, short of that are things more like just simply tracking outcomes. And that goes back to the phase 1 of the presentation, is, you know, just make sure that you have clear outcome defined and that you're tracking the data and whether you're achieving the outcomes. And in some cases, like something as clear as improved high school graduation rates, that's great. But you really want to know, because there's a lot of times where a lot of things are going on, and you don't want to, you know, say that you decide you're going to give lollipops to everybody, and suddenly there's, you know, there's a big shoot up in a big increase in high school graduation rates. You can't say lollipops did it because maybe the chancellor's over on the other side doing all the evidence-based stuff, right? So you want to know whether your thing produced that result. But sometimes, you know, sometimes you don't always have that luxury, and you minimally want to track outcomes.
Fantastic, really helpful answer, Linda. Do we have any questions on the line?
If you do have a question, please press the *1 and please record your name. And we do have one question, one moment. Go ahead, Crystal, you may ask your question.
Great, and thank you, Linda, for your comments thus far because they've been very incredibly trenchant. My name is Crystal Okafor. I'm calling from My Brother's Keeper, Philadelphia, and I'm interested in knowing your perspective on the role of a convener or the role of a mayor's office in moving this work forward. I'm sort of oscillating between two positions. One, I think you've mentioned how we can assist some of our direct service providers within city departments. But I'm also thinking about how we can provide regular and sort of clear access to population-level outcomes data. So I'm wondering what you think is the best sort of first step here in encouraging evidence-based practice within the city, within any city, in a way that's in alignment with My Brother's Keeper. Should we, A, provide information around things like the percent of Philadelphia children who have access to high-quality pre-K, or the percent of Philadelphia children who are at risk of becoming developmentally dislayed? Or should we work with providers within our Department of Public Health to help them begin to articulate their theory of change around their fatherhood engagement and education programs? What do you think is the best next step or first step for a city that wants to really work towards fidelity to what works?
Oh, holy moly, you ask a hard question. I think where we are lacking as a field is citywide information that's shared among multiple partners. And I'm a big fan in the belief that when you start a discussion and convene partners around a shared goal of making change, that if you start with the data, that you're going to get a lot more clear focus and momentum. And so I think if it was a blank slate, I would start with identifying, the 5 most important indicators that you're going to, that show outcomes in what you want to work on, and work really hard to get all the partners to deliver the information and produce that data and update it routinely. And because that has the benefit of shaping the conversation for the whole community and providing momentum for, multiple programs. So I think that baseline of shared knowledge is going to be an important piece of glue that we need to build out a lot more and use effectively. So that would be my instinct if it was a blank slate.
That's very helpful. Thank you.
Okay, and we do have another question. We have Brian Weeby.
Hi, Brian Weeby with Horizon Education Alliance in Elkhart County, Indiana. I'd kind of like to direct my comments to all 4 of the speakers, if that's okay, just all very helpful. Maybe don't tell the others the previous technical assistance calls, but I think this is the most helpful and practical, very inspiring, so thank you. This treasure trove concept I'm intrigued by. Elkhart County is about to be famous. We're a little famous because February 2009, President Obama, it was his first trip out of the White House because it was so bad here. Unemployment had gone from 4% to 20%. He announced last night, the White House announced that he's coming back, kind of a victory lap, I guess it would be. Coming back because of the economic success, yes, that's it. What he may not know about, but what we're excited about, following that crisis, our entire community came together and centered around education. We would transform Elkhart County through education. So an organization emerged, all 7 superintendents of the 7 school systems, and then industry CEOs. We hired a PhD director of research, the best move we made on day 1 when we started fall 2012, developed a theory of change, collecting baseline data on community goals, et cetera. And then we really pursued evidence-based practices. So we traveled around the country. I personally have been on about 40 trips. We found early college high schools and now have those going in every school in the county, every high school, 8. We applied for an I3 grant last year, and we're rated, we think, the highest in the country, but we got thrown out on a technicality. Triple P for parents is positive parenting program. It's in the What Works Clearinghouse, very highly rated out of Australia. PAC's Good Behavior Game is a first-grade intervention on self-regulation. So we put these all together, and we think we probably have more RTC-backed initiatives than anywhere in the country. We had 3 small-town mayors come to D.C. for the first national convening of MBK, and so it's good. It's not like Philly or Miami or New York, but 3 small-town mayors, and we certainly have students of color here that we're trying to support, the guys especially. My question is this. There seems to be this confluence of really good things, and most of them have been mentioned here. Salesforce and technology. 20 years ago, Salesforce didn't exist, and the first 2 callers talked about that. This whole thing of evidence-based practices, I look at it, and the last 40 years have been remarkable for that. RCTs have taken off. Social impact bonds were mentioned. The 4th one I'd say is just networking, the whole collective impact and how communities come together around aligned goals and doing that. So unbelievable opportunity for the United States, for the whole world to put all these 4 things together. My question is this: how can we bring together, how can we do more of the networking, national networking with pilots around the country? We think Elkhart County is a lab because we were hit hard and we've responded in a big way. How can pilots of communities that are doing this, we came together once, February 12, 2015 at the White House, but we need more support. We need to learn what others are doing and those that are really putting a lot of these things in place. And whether it's David Wilkinson there at the White House, I know he knows Indiana because he's been to the Lilly Family School. It's a great foundation in our community. Can some of the players come together so we can learn more and put all this together in a few places around the country, hopefully many places?
Thank you for that comment and question, Brian. Do any of our speakers want to offer up a suggestion?
This is Linda Gibbs. You know, Brian, that was really remarkable, and I think when a lot of cities are saying this, they want to have time to learn from each other and talk to each other. We actually are starting some of that work and just to explain, Bloomberg Associates has been using our consulting nonprofit capacity to support a number of cities in the U.S., and so I feel like sometimes I carry a lot of those lessons in my suitcase from city to city and try to share it in that way. We're trying to support this effort by doing some convening work, and the reality is that it's incredibly taxing time and effort, and so it would be really interesting, and I don't know, Karen, if you have ideas, but it feels like that there's got to be some technological learning platforms where people can sort of, you know, throw new stuff up there, ask questions, and I don't know in your work whether you've seen any of those type of opportunities as well, but it feels like we need some new solutions here.
Hi, this is Karen. I would just say, I mean, we do this for our partners, for the people that belong to Results First. Actually, I just finished, we're about to release Igloo is the company that we're using. It's a software platform that you can kind of design, and it serves as an intranet where people can access resources. There's a discussion board, there's announcements. And so I think if there's somebody that can serve as that central entity, I definitely agree with you that there's ways, because we have the same issue, that it's really hard to and time-consuming to get people together, but a community of practice is so key for the success of any of these initiatives, and to make sure that other people have access to this information. So I think there are things out there. I think it's just a matter of finding the right person to coordinate it.
And thanks. This is Dave Wilkinson here at the White House. I think that is an excellent question. Congratulations on all the progress in Elkhart. I know the President is looking forward to featuring your success and your response. I think your question about communities of learning are very important. It is very important, and that we can be doing even more. We know, for instance, that that federal, state, and local governments combined spend billions of dollars a year on technical assistance, and much of those resources are spent to assist service providers in complying with federal rules and state and local government compliance requirements. A lot of it may be spent on report writing and websites that may not have high visitation. So one thing we're very interested in is how can we better deploy technical assistance to facilitate community learning towards evidence, better and more effectively disseminate evidence of what works, and also use this tremendous resource to better connect service providers with the data that they need and with the tools for using that data to learn, course correct, and continually improve. I think a huge part of that also needs to be communities of learning and interchange between cities and dialogue. Where we are seeing this happen often is around a particular issue area rather than broadly on the issues of using data and analytics and deploying evaluations and adapting evidence-based programs for your community, et cetera. So this is certainly a priority for us. We think that we've made tremendous, just as Elkhart has made tremendous progress over in the last 7.5 years, we feel like we've made very strong progress as a federal government and in state and local governments around the country, but we certainly know that we can do more. We feel like we're beginning to get some real proof of concept that these sorts of things work, and we hope that it drives more demand and demand for creating these types of communities of learning. we are right now soon to launch. If you're in a county, the Data-Driven Justice Initiative, which is not yet announced, which is focusing on reducing recidivism, particularly for superutilizers. So we're creating a community of counties who are committing to take specific evidence-based actions on that issue. And we could certainly name, and I think many people could think of, issue-focused communities of learning that may include some integration of data. We're also seeing this, I think one of the greatest examples that's more general, though you have to apply to join it, is the Bloomberg Philanthropies, so Linda's partner organization, Bloomberg Philanthropies What Works Cities Initiative, which is very exciting, but unfortunately not applicable, I think, for a county to join. So I think there's an increasing number of examples out there, and leaders like yourself should call for it and indicate the need, and hopefully federal government and philanthropy will rise to the cause.
Thank you so much.
Thank you, Dave. Do we have any more questions on the line?
There's no questions at this time.
Right. Let me ask a question that came in from the chat feature, and I'm going to, this question is probably actually it could be applicable to everyone. So the question is, how would someone find randomized control trial evaluations that are closely aligned with MBK milestones? This person is looking to find places where the data is disaggregated by race in such a way that they can understand how what's working for young men and boys of color could parallel the 6 milestones.
I think this is Linda. I think what's really wonderful about that question is the appreciation that the experience of young men of color can be different than the experience of whites, quite frankly. And that looking at the evaluations, what I would do is I would go onto Karen's website, I would look at the area that you're looking for and research programs within the area of impact, and then I would just go to who the test and control groups are. And if the test group is, overwhelmingly an Asian population, then that might, you could feel more confident that it would work if your Asian population is who you're focused on. If it's Latino, you could feel more confident. But if you're focused on Asians and the study is Blacks, then you would, I think, have, you need to raise the question about whether it would be transferable. And that really gets to the essence of this work, that the experience for young men of color is different than other young men.
And I would just add, this is Karen, I think too, going, as I always will say, going to the Clearinghouse's web pages, a lot of them do things by ethnicity, by gender, by age, to allow you to kind of drill down a little bit more to find the information that you need. And I will say that I know when MBK was being put together, the clearinghouses came together to look at this, and so there's some fishing that needs to be done to kind of get at exactly the population that you're most concerned about, but a lot of information is available on the sites.
Great. Thank you, Karen and Linda, for your responses to those questions, and thank you to Guy, Johanna, Karen, and Linda for your really helpful remarks and the responses you provided to all of these questions. We are nearing the end of our time, and we want to thank you all for sticking with us for this hour and a half. It is now my pleasure to introduce Michael Smith, who is Special Assistant to the President and Senior Director of MBK at the White House, who will provide closing remarks.
Hey, thanks so much, Laura. Good afternoon, everybody. I guess still good morning to some folks on the West Coast. I just want to say thank you all so much for joining today. I was able to be on the end of the webinar, and it's such incredible content. And so I want to start off by saying Thank you to Laura, thank you to Dave, thank you to Erica and everyone at the White House Office on Social Innovation for really making sure this whole series took off and putting your heart and soul into it to make sure that the communities that are gathered on the call could benefit from great minds like we have and also really have these opportunities to come together and think about what works, which is really at the core of My Brother's Keeper. You know, everything we're doing is about programs and interventions that have shown measurable evidence of success because as you've heard on this call, you know, we just don't have enough money, we don't have enough time to keep investing in things that look nice, that serve a lot of people, that have anecdotes of success, but really we've got to invest where there's impact. Then we have to track it and we've got to measure it and be really transparent about it. We're very grateful to our speakers today who have been working to identify and build on what works for many years, and I just want to thank you so much for being part of this webinar. So Guy, thank you so much. Guy, excuse me. Johanna, Karen, and Linda, thanks for taking the time to share your insights this afternoon. Thanks everyone on the phone and the webinar for joining the MBK What Works Technical Assistance Series. We hope that you found this valuable, which I am sure that you did. I want to let you know that you're going to be getting a post-session survey in the next few days that'll have some questions about how the session went. We want to make sure that we can continue to improve these to meet your needs and for others that might join. So please, when you get that survey, just take the 5 minutes to complete it. We're also glad to let you know that there's going to be a recording of today's webinar, which will be posted on the resource page of the MBK website. So if you go to whitehouse.gov/MBK and click on resources in the next few days, you'll be able to get the recording of today's webinar. And when you share it, feel free to share it via Twitter, Facebook, etc., and use the hashtag MyBrothersKeeper when you do that. The next MBK What Works TA session is going to take place on Wednesday, June 22nd at noon. That's Wednesday, June 22nd at noon, and we're going to be focusing on identifying and contributing to what works. We've got another series of great speakers that are lined up for that session, so please be on the lookout for that announcement within the next few weeks. And then one final thank you to the number of groups that have supported the My Brother's Keeper What Works TA series through their outreach that you saw listed in the various communications that came out about this, and to the Social Innovation Fund, my former colleagues over there, for providing this webinar platform for us to use. So I want to say thank you again, everyone. We hope that you enjoyed this, and we hope that you have a great afternoon and a restful Memorial Day weekend. Team Social Innovation, anything else to add?
No, that's it, Michael. Thank you very much for helping us bring all of this together and to all the attendees.
All right. Thanks, everybody. Have a great one. Bye-bye.
Thank you. This completes today's conference. You may disconnect at this time.